What I'm about to tell you might make you pause tonight before you go to sleep, because I've seen patients who went to bed feeling fine and never woke up again. No warning, no pain, just silence. And the truth is, many of them were doing something so common, so normal, they never once questioned it. Before we go any further, if you care about your health or someone you love, take a moment to like this video and subscribe. I share these insights because sometimes the smallest awareness can quietly save a life. Now, let me speak to you as I would to a patient sitting right in front of me. Most people don't realize that what you do in the final hours of your day can have a profound impact on your heart, your blood sugar, and even your risk of stroke while you sleep. Nighttime is not just rest time. It's when your body performs critical repairs. Your heart rate slows, your blood pressure shifts, your glucose levels fluctuate, and if something is off, even slightly, it can create a silent storm. I've seen this happen too many times. A person eats a heavy late dinner, maybe something sugary or processed. They feel a bit full, maybe slightly uncomfortable, but nothing alarming. They lie down thinking sleep will fix it. But inside the body, something very different is happening. Blood sugar rises sharply. The heart has to work harder. Blood becomes slightly thicker. In some cases, this combination may increase the strain on the cardiovascular system. For someone already at risk, perhaps with undiagnosed diabetes, high blood pressure, or early heart disease, this can become dangerous. What makes this even more concerning is how quiet it is. There are no loud warning bells, no dramatic symptoms, just subtle signs that most people ignore. A little fatigue after dinner, slight heartburn, a feeling of heaviness in the chest, maybe even restless sleep. What I'm about to share with you could change how you see your nightly routine forever, because the danger isn't always what you think it is. And if you've been doing this one common habit for years, your body may already be trying to tell you something, very quietly. You just have to know how to listen. What I'm about to tell you might surprise you, because it doesn't feel dangerous at all when you're doing it. In fact, for many people, it feels comforting, routine, even deserved after a long day. I'm talking about eating late at night, especially meals that are heavy, sugary, or high in refined carbohydrates. Most people don't realize that your body handles food very differently at night than it does during the day. As the evening approaches, your metabolism naturally slows down. Your insulin sensitivity decreases, which means your body becomes less efficient at managing blood sugar. So when you eat that late dinner, or that harmless snack before bed, your glucose levels can rise higher and stay elevated longer than you expect. I've seen this happen too many times. Patients tell me, "Doctor, I don't even eat that much." But when we look closer, the timing tells a different story. When blood sugar remains elevated at night, it doesn't just quietly settle. It can trigger a cascade of internal stress. Your heart rate may increase slightly. Your blood vessels may constrict. In some cases, this environment is linked to increased strain on the cardiovascular system, especially in individuals who already have underlying risks. And here's the part that worries me the most. You're asleep while all of this is happening. You're not aware of the subtle palpitations. You don't feel the fluctuations in blood pressure. You can't sense the extra work your heart is doing. It all happens in silence. What makes it even more concerning is that late-night eating often comes with other habits. Lying down shortly after meals, scrolling on your phone, or dealing with stress that hasn't fully settled. These small behaviors, when combined, may compound the effects on your body. Now, I'm not saying that every late meal will lead to something serious, but what I am saying is this: if it becomes a pattern, especially over months or years, it can quietly increase your risk in ways most people never consider. And your body does try to warn you. You might notice that you wake up feeling unusually tired, even after a full night's sleep. Or your mouth feels dry. Maybe there's a slight headache in the morning, or a sense that your sleep wasn't truly restful. These are not just random inconveniences. Sometimes they're signals that your body is struggling overnight, trying to rebalance something that was pushed too far before you even closed your eyes. And there's one specific warning sign during the night that many people completely overlook, something that could be quietly pointing to a deeper issue. I want you to think carefully about this, because this is something many of my patients mention only after I ask them directly. Have you ever woken up in the middle of the night, not fully sure why? Maybe your heart felt like it was beating a little faster. Maybe you were slightly sweaty, a bit anxious. You turned over, adjusted your pillow, and tried to go back to sleep, telling yourself it was nothing. Most people don't realize that moment might not be random. What I'm about to tell you could change how you interpret those nighttime awakenings forever. During sleep, your body is supposed to enter a calm, stable state. Your heart rate slows. Your blood pressure gently dips. Your nervous system shifts into repair mode. But when blood sugar levels spike and then drop rapidly, something that can happen after late-night eating, especially with sugary or processed foods, it may trigger a stress response inside your body. Your brain senses that drop as a potential threat, and in response, your body releases stress hormones like adrenaline and cortisol. These hormones are designed to wake you up, to alert you, to protect you. That's why you might suddenly feel your heart racing, your body slightly trembling, or a sense of unease that you can't quite explain. I've seen this happen too many times. Patients describe it as a weird feeling, not quite pain, not quite panic, just something off. And here's the part that often gets missed. They go back to sleep and forget about it the next day. But when this pattern repeats over time, it can place ongoing stress on your cardiovascular system. These repeated surges in heart rate and blood pressure during the night are not ideal, especially for individuals with underlying conditions like high blood pressure, insulin resistance, or early heart disease. It doesn't mean something catastrophic will happen immediately, but it does mean your body is being pushed out of balance more often than it should be. And your body, in its quiet way, is trying to get your attention. You might also notice other subtle clues: waking up feeling unrefreshed, experiencing vivid or restless dreams, needing to urinate more frequently at night, even mild chest discomfort that comes and goes without clear reason. Individually, these may seem harmless, easy to ignore, but together, they can form a pattern that suggests your body is not getting the deep, restorative sleep it needs, and more importantly, that something beneath the surface may not be functioning as smoothly as it should. And there's another daily habit, one that seems completely unrelated, that may quietly make this entire situation worse, especially if it's part of your evening routine. What I'm about to share with you might feel unexpected, because it's something almost everyone does, often without a second thought. It's the habit of lying down too soon after eating. I've seen this happen too many times. Someone finishes dinner, feels full, maybe a little tired, and within minutes, they're on the couch, or already in bed. It feels harmless, even relaxing. But inside your body, the story is very different. Most people don't realize that when you lie down shortly after a meal, your digestive system is forced to work against gravity. This can slow down digestion and increase pressure inside your abdomen. As a result, stomach contents, including acid, can move upward more easily. You might recognize this as heartburn or acid reflux, a burning sensation in the chest, a sour taste in the mouth, maybe a slight cough or throat irritation at night. But what many people don't know is that these symptoms can sometimes mimic or even mask deeper cardiovascular discomfort. That tightness in your chest, that pressure you brush off as just indigestion, it can be confusing, especially at night when your body is already in a vulnerable state. Now, I'm not saying every episode of heartburn is dangerous, but I am saying this. If your body is dealing with poor digestion, rising blood sugar, and a stressed cardiovascular system at the same time, especially while you're lying flat, it creates a combination that isn't ideal. Your heart may have to work a little harder, your breathing can become slightly more shallow, and if you already have underlying risk factors, even mild ones, this environment may place additional strain on your body. And again, you're asleep while this is happening. You don't feel the full picture. You only experience fragments, maybe a restless night, a slight burning sensation, or waking up feeling off without knowing why. Over time, this habit can also affect sleep quality. Your body struggles to enter deeper sleep stages because it's still focused on digestion and maintaining balance. And when sleep quality drops, it can influence everything: your blood pressure, your blood sugar regulation, even your heart rhythm. This is how small habits quietly build into larger patterns. What feels normal becomes routine. What becomes routine becomes invisible. And yet, your body keeps sending signals. A little discomfort here, a restless night there. Nothing dramatic, but not entirely normal either. And there's one more overlooked factor, something emotional, something internal, that many people carry into the night without realizing how deeply it affects their heart and overall health. Next. What I'm about to tell you might be the most overlooked piece of all, because it doesn't come from food or posture or even physical habits. It comes from something you carry silently: your stress. I've seen this happen too many times. Patients do everything right on the surface. They try to eat better. They go to bed on time. But beneath it all, their mind is still racing when their head hits the pillow. Most people don't realize that emotional stress doesn't simply turn off at night. It follows you into your sleep, and your body responds to it in very real, very physical ways. When you're stressed, whether it's from work, finances, family concerns, or even unresolved thoughts, your body produces stress hormones like cortisol and adrenaline. These are helpful in short bursts, but when they remain elevated into the night, they can interfere with your body's ability to fully relax. Your heart rate may stay slightly elevated. Your blood pressure may not dip the way it's supposed to during sleep. Your breathing can become more shallow or irregular. And here's what's important. Even if you fall asleep, your body might not truly rest. You may drift in and out of lighter sleep stages. You might wake up without remembering why, or you may wake up in the morning feeling like you never really recovered. Over time, this pattern can place ongoing strain on your cardiovascular system. Not suddenly, not dramatically, but quietly, gradually. I've had patients tell me, "Doctor, I sleep all night, but I still feel exhausted." And when we look deeper, it's not just about how long they sleep, it's about the quality of that sleep and what their body is experiencing during those hours. Stress also affects blood sugar regulation. When cortisol levels stay elevated, it can cause your body to release more glucose into the bloodstream. So even if you didn't eat late, your blood sugar may still rise during the night. This creates a cycle. Stress affects sleep. Poor sleep affects blood sugar. Fluctuating blood sugar puts strain on the heart. And the cycle continues, often unnoticed. What makes this so concerning is how normalized it has become. People accept stress as part of life. They carry it quietly, they go to bed with it, and wake up with it, without realizing how deeply it's affecting their health. But your body doesn't ignore it. It responds, every single night. And sometimes, the signals are so subtle, they don't feel urgent until they are. There's another sign, something many people experience in the early morning hours, that could be your body's way of asking for help. And it's often dismissed as something completely harmless. I want you to pay very close attention to this, because it often shows up so quietly that people dismiss it without a second thought. Have you ever woken up early in the morning, earlier than you intended, with a strange sense of discomfort in your body? Not sharp pain. Not something you can clearly describe. Just a subtle heaviness. Maybe in your chest, your arms, or even your jaw. most people don't realize. The early morning hours are when your body is at one of its most vulnerable states. As you approach waking, your body begins to prepare itself for the day. Hormone levels shift, cortisol naturally rises, your blood pressure starts to increase. Your heart rate picks up slightly as your system transitions from rest to alertness. This is all normal. But when underlying factors are present, like unstable blood sugar, poor sleep quality, chronic stress, or cardiovascular strain, this natural transition can become less smooth. I've seen this happen too many times. Patients describe waking up with a vague sense of unease, a slight tightness in the chest, a feeling that something isn't quite right, but not enough to cause alarm. So they ignore it. They get out of bed. They start their day. And within an hour or two, the feeling fades, as if nothing ever happened. But here's what I want you to understand. These early morning sensations can sometimes be your body's way of signaling that it struggled overnight and is now under pressure as it shifts into daytime function. This doesn't mean something serious is happening every time, but it does mean it's worth paying attention to, especially if it's recurring. You might also notice other small details. Feeling unusually fatigued in the morning, a slight dizziness when you stand up, mild shortness of breath that resolves quickly, even a sense of anxiety that seems to appear out of nowhere. Individually, these may seem insignificant, but together, they can form a pattern that your body is trying to show you. And this is where awareness becomes so important, because the goal is not to create fear, it's to recognize signals early, while there is still time to respond, adjust, and support your body in the way it needs. Small changes, made consistently, can improve how your body handles the night and how it prepares for the day. And that brings me to something very important, because everything we've talked about so far, every habit, every signal, leads to one simple question. If you've been listening closely, you may have already started to recognize pieces of yourself in what I've described. And that's not something to ignore. It's something to gently act on. Because the truth is, most of these risks don't come from one single event. They build slowly, quietly, through everyday habits that feel normal, until your body starts asking for help. What I'm about to share with you isn't complicated and it doesn't require anything extreme, but it does require awareness and consistency. Start with something simple. Give your body time between your last meal and sleep. Even a small gap, 2 to 3 hours, can help your system process food more effectively before you lie down. This may support more stable blood sugar levels and reduce unnecessary strain on your heart during the night. Pay attention to what you eat in the evening. Heavy, highly processed, or sugary meals late at night can be harder for your body to manage while you sleep. Choosing lighter, more balanced options may help your body settle into a more restful state. And just as important, how you transition into sleep matters. Try to create a short window of calm before bed. Step away from screens. Allow your mind to slow down. Even a few minutes of quiet breathing, gentle stretching, or simply sitting in stillness can signal to your body that it's safe to rest. I've seen this make a meaningful difference for many people. Not overnight, not dramatically, but gradually, in a way that supports long-term health. If you notice recurring symptoms, like waking up at night with a racing heart, persistent morning fatigue, or unusual discomfort, it's worth having a conversation with a qualified healthcare professional. Not out of fear, but out of respect for your body's signals. Because early awareness can lead to simple interventions. And simple interventions over time can protect what matters most. Your heart, your energy, your ability to wake up and live your life fully. Most people don't realize how much their nighttime routine shapes their overall health until something forces them to pay attention. You don't have to wait for that moment. Listen to your body now. Make small adjustments. Stay curious about what you feel, especially when things seem slightly off. because sometimes the difference between risk and resilience is simply awareness acted on in time. And tonight, as you prepare to sleep, I hope you remember this, not with fear, but with clarity. Your body is always speaking, and now you know how to start listening.